Important. If you are currently in crisis, please call or text the Suicide Crisis Line at 988 or go to your local hospital. The following presentation is meant to support the mental well-being of nurses, but in no way replaces the need for medical professionals or any prescribed treatments you may require. Admitting to needing help is the first step. Having the insight to seek out medical attention and recognizing the need for help in coping shows your unwavering strength and dedication. It is okay to not be okay. Welcome to the WeRPN Practice Resources, Self-Care for Nurses. This module, Mental Well-Being, Anxiety, developed by WeRPN with the support of the Government of Ontario. In this module, we will look at what is anxiety, the types of anxiety, how it can present its signs and symptoms, how to recognize when intervention is required, some healthy coping mechanisms, and self-care tips. Anxiety is described in the Merriam-Webster Medical Dictionary as an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs, by doubt concerning the reality and nature of the threat, and by self-doubt about one's capacity to cope with it. Everyone experiences symptoms of anxiety, but these are generally occasional and short-lived events and do not cause ongoing or long-lasting problems. But when the cognitive, physical, and behavioral symptoms of anxiety are persistent and severe, and anxiety causes distress in a person's life to the point that it negatively affects his or her ability to work, study, socialize, and/or manage daily tasks, it may be beyond the normal range. There are many types of anxiety, and they may affect each of us differently. People with anxiety disorders may feel anxious most of the time, or for brief, intense episodes which may occur for no apparent reason. They may have anxious feelings that are so uncomfortable that they avoid daily routines and activities that may cause these feelings. Some people have occasional anxiety attacks so intense that they are either terrified or immobilized. These are all signs of anxiety, and they are normal reactions to stressful, difficult, or dangerous situations. Anxiety becomes a problem or issue if the signs of anxiety occur without any obvious cause, if the reaction is greater than a situation calls for, or if these feelings of anxiousness interfere with your ability to function or cope in your day-to-day life. Take a minute to assess where you are on the characteristics of the screen. If you feel you're exhibiting one or more of these symptoms frequently, it may be time to refocus and/or reach out for help. Self-reflection can be hard, and sometimes it takes someone to point out that we're not okay before we recognize or process this information ourselves. Take a moment to access the free anxiety self-assessment tool. This tool can assist you in self-reflection and provide you with an idea of where you stand with your anxiety level. Keep in mind that nothing is 100% accurate, and no matter what your score is, if you are concerned about yourself or a loved one, seek assistance from a healthcare professional. Time out, let's cope. Making time to care for ourselves can be challenging at the best of times and was identified as even more essential during times of crisis such as the COVID-19 pandemic. Exercise is one of the best ways to reduce anxiety and lower stress and is as important as rest and sleep. Making sure you're getting a good night's sleep helps the body and the mind rest. Review the WeRPN self-care module for more information about physical self-care. There are suggestions for ways to improve exercise, relaxation, and sleep. Understanding what and how you experience anxiety is helpful to controlling it. Watch out for things that can initiate anxious moments and learn how to reduce or control these triggers. It will help you to keep your anxiety under control. Refraining from self-medication with drugs or alcohol is crucial as these activities can make your anxiety worse and negatively add to the issues you're experiencing. Taking time for yourself by doing the things you enjoy will help to lessen anxiety. Meditation and volunteering are two examples of ways to engage in meaningful exercises and experiences. For some, Their anxiety can be a symptom of post-traumatic stress disorder and may require more intense and professional assistance. Meeting with a trained professional is one way you can work through the harmful memories or experiences to better understand what you are feeling. And finally, becoming mindful allows you to focus on the present and what is happening around you. By paying attention to your body and your surroundings in the moment, it will help to reduce anxious thoughts of the past or future. By practicing STOP or stop during stressful moments and throughout the day, you can gain perspective of the situation and empower yourself to respond in a situation in a calm manner. Mindful 2020. S. Stop and take a moment away from the situation. T. Take a breath. O. Observe what is happening around you. P. Then proceed with a helpful action. Sometimes you just need to stop what you're doing, and taking this break will help you to see things more clearly. The PTSD Association of Canada developed the following strategy for coping with crisis. This strategy can also be used when experiencing anxiety. PTSD Association 2020. F. Focus on what's in your control. The first step is to focus on our behavior, as that is something we can control. Responding effectively to crisis means acknowledging our thoughts and feelings about what is going on and behaving in a positive, constructive way. This is achieved by following the next three steps: A, C, and E. A. Acknowledge your thoughts and feelings. The goal is to recognize what you are feeling and thinking a certain way. Don't try and ignore it. Examples of this would be, I'm feeling sad, or I'm worrying again. C is come back into your body. Focus on your body and the control you have over it. Keep acknowledging your thoughts and feelings, but begin to connect with your body and move it. Examples of this would be to sit straight in your chair, pressing your fingertips together, stretching your arms, slow your breathing. E, engage in what you're doing. Focus your attention on the task at hand and recognize where you are. This can be achieved by identifying 5 things around you or 4 things you can hear. Finish this exercise by paying full attention to the activity you're doing. It's recommended that you complete the ACE portions slowly, 3 or 4 times to make it a 2 to 3 minute exercise. Here is one example of an anxiety screening tool that you can take, produced by mentalhealth.ca, an initiative of the Children's Hospital of Eastern Ontario, also known as CHEO.